Hi everyone, it's AnneMarie Chiz with another AMC Connects. Thank you all for tuning in. Again, hope you're enjoying some of the updates and modifications. Today it's just me. We're going to jump right in to some really important updates if you haven't seen them. I hope before I get into that you enjoy Dr. Bushnell. What a great person to have on the podcast. Chuck and I were just commenting how neat it was that he had some grounded messages for us, for the community, both inside the organization and the community at large in terms of the expectations that we can all plan on when we visit the Rome Health Emergency Department, because it's just a wonderful place and so proud of that team. And enough is never enough. That's what I love about Rome Health, is that when we reach a bar, we reach even higher and higher and higher. And the emergency department team, led by Dr. Bushnell and Kelly, who's been on with us before too, they just do a great job in serving the team there. Well, with that, we'll jump right in. It's been a bit. I was a little bit delayed, but it's time for another monthly update. And 2026, the goal was to make sure month over month that I was providing an update, because we have so much going on in 2026. How can I make sure that we all stay on the same page? So some reports written and sent out through communications, as well as on the podcast. So we'll jump right in. Dear Rome Health colleagues, every month I want to share where we stand as an organization, what's going well, where we have work to do, and how each of us plays a role in moving Rome Health forward. Being transparent with you is important because the challenges we face belong to all of us, and so do the opportunities to improve. As you all know, I've announced since late 2025 that some of the challenges associated with coverage and covered lives when it came to the HR1 approval was going to impact us financially starting this year. So here is the latest picture. Through June of 2026, our financial results show both progress and areas of need for our attention. Net patient service revenue really was higher than last year, but behind 2026 budget, about 5.7% below our budget, primarily because of lower than expected volumes in skilled nursing, surgical services, and clinic visits. Operating expenses also exceeded budget at the same time, although improved. While expenses were slightly below budget, they continued to grow faster than our revenue. As a result, we ended the first 6 months of the year with a $4.1 million operating loss compared to a budgeted plan of a loss of $2.8 million. These numbers matter because they directly affect our ability to invest in our people, technology, facilities, and the services that the community has come to depend on us so much. So we've had a few things going on that I'll update us. They certainly are working, but we have to pick up the pace. We are focused on the right priorities. The good news, again, is that our priorities have not changed. We are working on the right things. Our focus continues to be growth. We want to make sure that we are always open to everyone and anyone that needs us, and that we are focused on continuing to grow volume in the services that we do so well. Reducing excess days in the hospital, optimizing our case mix index, making sure that we are capturing all the great work that we do based on the patients that we're taking care of. Maximizing staffed capacity. This has been a big one for us this year. We have areas of our network that are staffed, but it doesn't necessarily match up to when and how patients flow. And we're working to make sure we manage that very, very tightly this year. That is working well for us. The challenge is staying disciplined. Every day things bring new demands, and I say some serious headwinds come at us at any given day. Unexpected situations and competing priorities. Even so, we must continue doing the work we know improves patient care and strengthens our organization. Progress doesn't come from one big change. It comes from consistently doing the right things every day. Going into a bit of those. Challenging the status quo. Healthcare is constantly changing, and so must we. I encourage every colleague to continue asking questions and challenging the way we've always done things. If a process creates delays, frustration, or unnecessary work, speak up. This is kind of called white space. And where you all view the organization matters. Our patients' feedback, the community's feedback matters. Is it feels like that there was something that didn't make sense? It probably didn't, and we need to go after improving it. If you see a better way to care for our patients, please share it. Continuous improvement starts with curiosity. It requires us to be open to new ideas while keeping one question at the center of every decision. What is best for our patients? Standard work creates better care. One of the most important ways we can improve is by reducing unnecessary variation in our system. Our patients deserve the same high quality care regardless of who is working, which day of the week. It should never matter. It shouldn't matter if the care is delivered on a weekend, a weekday, a day shift, or a night shift. It always is the best care. That's why written standard operating procedures and policies are so important to create. Breaking the cycle of chaos. Many times healthcare has a lot of unexpected challenges. A lot of the human professions do, and that can cause chaos, and we want to make sure that we're always inserting control in all that we do. Healthcare will always be unpredictable and have unpredictable moments. We care for people during some of the most difficult days of their lives. But when unpredictability becomes our normal way of operating, it can create stress on patients, families, and certainly all of us. Over the past 2 months, we've experienced multiple code green events, for example, which largely means the demand for inpatient services has exceeded the capacity in our emergency department and in our acute care environment. We want to make sure that we address that. When patients are ready for discharge, we remain steadfast in making sure that happens safely so that we can create capacity for the community to receive our care. A better way forward. To help us create more predictability and reliability in operations, we are forming an interdisciplinary team that is redesigning how patients move through the hospital. The goal of patient-centered progression is to reduce excess days while improving the patient experience in every way. Between now and October 1st, we'll be preparing to launch a centralized patient progression hub. This team will help prioritize care across the organization using real-time information and each patient's progress and expected length of stay and their needs after they leave the hospital site of care. Today, each department sets its own priorities. In the future, we'll work together from one shared view of which each patient needs to safely continue to transition in different levels of care. Very excited about this. Keeping patients at the center, of course. I know initiatives like these can sometimes feel like they're driven solely by finances, but that's not what this is all about. The reality is that they are driven by our patients. People don't want to wait for different aspects of their care, or they don't want to wait for things that are just that white space and they just feel like barriers. We want to make sure every experience, every moment is valuable for our patients and all of you. When we reduce unnecessary delays, patients recover in the right setting sooner. Families gain clarity. Our colleagues can focus their time and energy on patients who truly need the level of care that they're in. And we can strengthen Rome Health so we can continue serving our community for years to come. Thank you for everything you do each day. Healthcare is certainly not easy, and I know many days are demanding. Your compassion, resilience, and willingness to improve make a difference for every patient who walks through our doors. Together, we'll certainly keep going. If people didn't see that message, I hope it's helpful to have it and review it a bit on AMC Connects. While we still have a few minutes, I'm going to go over another announcement in case you didn't hear it. As Dr. Attilio shared, if you remember, if you didn't watch that episode, it was on AI. I suggest you go to it because Dr. Attilio did a great job talking about in a way that I think all of us could really understand because it's a pretty big topic. Very complicated at times, and it's coming at all of us in many industries fast and furious. But he had shared that the CareSync next steps are going to come quick. He had shared that there was kind of a lull, but now things are going to come fast and furious. And sure enough, we had a special announcement recently. Rome Health is excited to announce that the job descriptions for our CareSync implementation team are now posted online for all colleagues to review. And in the email, it gave that site and link so you can go right to it. We are seeking 3 implementation project managers and 16 core team members as part of our Meditech Expand implementation team. Very excited about this. What an opportunity for the community who might be looking for roles that fit their experience at Rome Health, or all of you within the workforce that might be looking to expand your professional career path into this particular very important project. We're so excited. So to apply, if you are interested in being considered for one of these opportunities, please submit your resume and or a statement of interest outlining your qualifications and experience to Kelly DeMizio at, we give Kelly's email, kdemizio@romehealth.org by August 10th, 2026. or apply online. Interviews and selections will take place by the end of August. So get on it, everyone, if you're interested with a transition to the new roles starting in September. And we give some great descriptions in there, such as an EMR implementation project manager and the job descriptions, as I said, and team leaders and team leads in particular specialties. Very exciting. Of course, there's a salary transparency in there, so you can take a look at it. And then those core team lead opportunities are just awesome in every area of the network. Because as a reminder, this adventure, this project that we're on, is actually the largest single project and investment that Rome Health will ever be on. That's non-bricks and mortar. We know we've had great environment updates, great projects in terms of our facilities. This one is the largest non-facilities based project we'll ever embark upon. So we need you. We need the best and brightest in these roles. So please tune in. And we are really seeking individuals who have a strong knowledge and experience within their assigned department or operational area and expertise, that understand departmental workflows and how they connect in other areas across the organization, are deeply respected and trusted by colleagues and leadership teams, have strong communication and collaboration skills, and are interested in helping improve processes and support positive change through technology. I would say those of us who are excited and motivated to be a part of the front end of change. I don't know about all of you, but sometimes I've been excited to be on the front end of change. Sometimes I've been in the middle of the pack and just kind of carrying, the weight with all of us that are working through a change. Or at times I've even been what's called a laggard. I've been on the other side of it thinking, please, no more change. I would just encourage us that all stages that we're in is okay. But on this particular announcement, we're looking for those people who are just really comfortable in leading through change and that this is exciting. Again, been on both ends of this in my professional career, and all is needed. But those of you who have those bright, shining eyes around this opportunity, please jump in. This message was from Dr. Attilio, again, our Chief Medical Information Officer, Nancy Levitt, our CIO, and Ryan Thompson, our executive sponsor for the project. So putting a plug in for all of them. I do want to say it is professionally life-changing being a part of a goal and a reality that will move into as close to a single record platform as possible. Very excited. With that, everyone, I'm going to close with a really neat announcement. This also just went out. It's really hot off the press. Rome Health in Rome, New York, has been recognized as one of just 312 hospitals nationwide to achieve methicillin-resistant Staphylococcus aureus.
Good luck with that one.
Forgive me, everybody. MRSA, rather. Bloodstream infection rate of 0, according to the latest Healthcare-Associated Infections Hospital database released by the Centers of Medicare and Medicaid Services, or CMS. The CMS Healthcare-Associated Infection Hospital database uses measures developed by the CDC and collected through the National Healthcare Safety Network to track how often patients acquire certain infectious diseases during the course of medical treatment. The latest data reflects performance from July 2024 through June 2025 and was updated May 13th. MRSA is a type of bacteria that is resistant to many commonly used antibiotics and can cause serious bloodstream infections, particularly among hospitalized patients. Preventing these infections requires rigorous adherence to evidence-based practices and strong culture of patient safety. This achievement reflects the commitment of every member of our care team for protecting our patients, stated Katie Friot, MPH RNCIC, Director of Infection Prevention at Rome Health, and many other duties as assigned. Katie's been on a special edition in the past. Amazing leader at Rome Health. Achieving a 0 MRSA bloodstream infection rate is the result of following evidence-based infection prevention practices, ongoing staff education and training, continuous quality improvement efforts, and regular monitoring to ensure we are delivering the safest care possible. Every patient deserves care in an environment where infection prevention is a top priority, and we are proud of the work our team does every day to make that a reality, stated Katie. She does an amazing job. She gives credit to all of us and the teams all around us, but she does an amazing job making sure that we're led through with those evidence-based practice standards. The CDC calculates a standardized infection ratio to compare hospitals' performance while accounting for factors such as care location, patient characteristics, hospital size, lab methods, and teaching status. The measures include all patients treated in acute care hospitals, including adult, pediatric, neonatal, Medicare, and non-Medicare populations. Healthcare-associated infection prevention is a cornerstone of Rome Health's commitment to quality. Through ongoing surveillance, multidisciplinary collaboration, staff education, and adherence to nationally recognized infection prevention guidelines, Rome Health continues to advance initiatives that improve patient outcomes and provide the best and safest possible care for the community. Thank you all for all that you do each and every day. Infection prevention is a real tall order these days with all that we have going on in societies and in diverse populations. So proud of the Rome Health workforce for ensuring that we have the best care out there here